everyone. Today is May 24th, 2023. Welcome to The Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen to find out how pharmacists and pharmacy students like us can improve population health, health equity, and patient care through advocacy and education.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the College of Pharmacy and the academic collaborations officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by our hosts and our guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island or the College of Pharmacy.
I'm Nicolau, a doctor of pharmacy student in my final year at the University of Rhode Island, working alongside Dr. Bratberg and the Rhode Island Department of Health over the course of the next few weeks. I'm extremely excited to be co-hosting the regimen for season 8 and can't wait to get started.
Hi, everyone. My name is Ashley Chiarello, also a doctor of pharmacy student in my final year at the University of Rhode Island. I'm excited to be in the regimen's second co-host for season 8, working with Dr. Bratberg as well as the Rhode Island Department of Health.
I can't believe it's season 8. Here we are in the summer, season 8. This is amazing. Welcome, Lucas and Ashley. The second time we have two co-hosts. Let's find out a little about yourselves on your first API rotation.
Yeah, of course. So as mentioned earlier, I'm in my last year of pharmacy school at URI, and I'm also a born and raised Rhode Islander from West Warwick. My public health interests include vaccinations, harm reduction, and social determinants of health. And some of my other interests include direct patient care with chronic disease states, as well as medication use safety and policy. With that said, I am very excited to be working on the podcast and can't wait to share the exciting episodes we have in store for this season.
And I'm originally from Stony Brook, New York, but I moved to Rhode Island about 5 years ago for college. I currently work as a pharmacy intern in the community setting at CVS. I have interest in public health in areas including women's health as well as oncology and cancer research. I'm excited to be working on this season of the regimen and learning with everyone about current public health areas.
All right, so what do we have planned for the 8th season of the regimen?
Yeah, we do have a lot in store for this season of the regimen. We'll be starting off by discussing specialty drugs used in multiple sclerosis and how pharmacists can get involved. We'll also be covering topics such as ways to increase methadone access for opioid use disorder in community pharmacies and the use of ChatGPT by the interprofessional healthcare team, their patients, as well as the community.
Yeah, as Lucas said, we are planning to cover a lot of topics on season 8 of the regimen. I will be discussing the pharmacist's role in breast cancer screening and prevention alongside the newest guidelines for screening at age 40, drug checking as harm reduction for people who use drugs, and the pharmacist's role in cannabis use, focusing on identifying and mitigating drug interactions. We will also be releasing new episodes each week with 2 new stat regimens next week, so be sure to tune in and stay up to date with the regimen for all things public health.
All right, very exciting, guys. Don't forget you can find new episodes every week from us. Don't forget to subscribe. Smash that subscribe button on Spotify, Apple Podcasts, Amazon Music, our YouTube channel, or wherever you listen to podcasts. Follow us on Twitter and Instagram for not only regimen content, but even more public health content coming your way at PharmD Pub Health. That's at PHARMD as in dog Pub Health. And turn on post notifications so you never miss an episode. Thanks.